All right, hello and welcome back to Real Seekers. I'm your host, Dale, the Real Seeker, and today we have a special treat. We have a returning guest, Jaime Castro. Hey, Jaime.
Hey, Dale.
Awesome, welcome back. Today we're going to be talking about the transgender movement and the LGBTQ, whatever else is on their movement and that sort of thing. I know that's an area of specialization for yourself. Just before we get into it, though, do you want to just tell the audience what you've been up to since the last time you've been on the show? Anything interesting, apologetically, or?
I guess I took a little break because I had a knee injury that I was looking after. But I have updated my website as at www.churchwatchdog.webador.com, where we talk about spiritual abuse and churches that abuse. This issue is related. It's interesting how everything's related because we talked about it the first time on the program. Now we're going to be talking about social cults. And so I've updated that with everything we learned in some of our investigation. So if people want to go there, there's a lot of information on there.
Awesome. And guess what? In the nick of time, we have Marvin Wallace joining us there. You look a little different there, Marvin. But
hi, how are you?
I'm good. How have you been on your end? What have you been up to? You've been on the show before as well. So
everything is good. Just working away here in Hong Kong. Let me try to get a decent avatar by the end of the show.
Okay. Well, it is in a way it's appropriate for today's topic, I guess.
Yeah.
Awesome. Yeah. Awesome. All right, cool. So as I said, today's topic we're going to be doing on transgenderism and the LGBTQ movement and that sort of thing. Now, Jaime, I want to start with you because you actually, this is a topic that's actually near and dear to you personally. You've had kind of your own personal experience dealing with your stepson who suffers from gender dysphoria. So do you want to just take some time to kind of outline your own personal experience before we get into the substantive topic?
I'll briefly go into it. I won't mention any name for privacy, obviously. I just want to correct you on one thing, Dale. I would not consider myself a specialist on this issue. I know a lot about it. It's always been an interest for me. But I have a stepson who's in his mid 20s now, and in his late teens, he came out as transgender and caused a lot of problems in in our family with our young kids. Um, and we tried to help him. And we went to our pastor. We talked to many counselors, secular Christian counselors. Our pastor connected us with a counselor that specialized in that issue. Um, but he refused to get any help. So he eventually transitioned. He had the reassignment surgery and he's living in Germany with his partner. Um, and so there's been a lot of, what's the word? Hostility there.
Yeah.
I wouldn't say on my part, but more on their part, in the sense that they do not accept that we disagree, and do not respect our rules in our home for our minor kids and the way they dress or behave and stuff like that. So, yeah, so that's been a struggle for me personally and for our family. It's definitely traumatized, I think, our young children. But we got through it, and he doesn't talk to me to this day. That's his choice, not my choice. Yeah.
Yeah, it's a shame that this kind of thing can divide families and stuff, and the impact on young children and everything like that. But yeah, Marvin, just out of curiosity, before we get into the substantive issues, do you have any personal experiences with the LGBT and transgender movement at all?
Not from family. It's a couple of LG, yes, in family, but not T in family, right? So I have met one or two people who are trans, but that's
That's about it.
yeah,
Fair enough. Fair enough.
it's sort of limited to that. Yeah.
Gotcha. Okay. But and I know that you've done a lot of research. I always catch you on the SNS boards. You always have something very substantive to say about this. So you definitely know a lot about the
Well,
movement.
I have an opinion. I don't know about know a lot about. It's kind of a complex issue that might be quite specialized, but I sort of have some general ideas and a few pastoral ideas about LGBTQ plus issues that
Gotcha. Gotcha.
I'm
All
looking
right,
at.
cool. Well, I think the first thing to do in that case, then, Jamie, I'll start with you again on this. Let's kind of take stock. Let's get a brief history of the trans movement. Some of the studies associated with this. So, yeah, go ahead and outline the history of this movement and what's been done.
Yeah. Just before I get into that, I just want to say that I also do have first cousins, one who's living as an open lesbian, and another one who's both brother and sister, and the brother is openly gay and married. And again, there's no communication there. When my stepson came out, they accused me of being hateful and bigoted and stuff like this, and that within itself, as we'll talk later, is hateful and bigoted because that's not what I am. I do not hate gay or transgender people. I actually have been friends with transgender people. I have very close friends. One of my best friends who's openly gay, and a boss who was gay, who were both at my wedding. So I had three people who were openly gay at my wedding. One of them sang at my wedding. So I'm not transphobic. I'm not gay. I take great offense to that. I think that within itself is hateful and intolerant and bigoted to call people names that they are not just because you disagree. Yeah, just to get into the history quickly. Someone who is an expert on this issue would be Dr. Quentin Van Meter. And he talks about, and I think you're going to post it Dale
On my
on the
blog,
video. Yeah. I would recommend anybody to look him up, Dr. Quentin Van Meter. And obviously, he's been demonized as well. Anybody who disagrees. But these are insiders. These are people from within their own community. But he talks about in one of his lectures the Three Musketeers, or the quack doctors behind the current transgender movement. The first one would be obviously Alfred Kinsley, who was not even a doctor. I think he studied bugs. But he engaged in the abuse and molestation of minors. He was a sadist and an exhibitionist. I mean, if he was living today, he would be in prison. Completely unethical what he did. The second guy was Dr. Harry Benjamin. Again, he was a quack doctor. His colleagues did not accept some of his radical snake oil remedies for some ailments that he came up with, and he's the one that started in the United States doing reassignment surgeries way back, right in the 50s, 60s. It's interesting that he was an avid proponent of eugenics, as most of these people were, and sterilization of minority groups. It's interesting that his organization, Dr. Harry Benjamin, he was German-born, and he was friends also with Magnus, and I'm not saying if I'm going to say his name properly, Hirschfeld, who was a founding father in Germany back in the 30s, before Hitler took over and destroyed his clinic and paperwork and research of this. He was openly homosexual and supporting transgender. So it's interesting that these people were connected to each other. They were connected to Freud as well, and Freud was not too keen on some of their ideas, which was interesting. So there was debate back then on this issue. But this guy, Dr. Harry Benjamin, he in the United States early on started doing hormone treatment and reassignment surgery, and his organization, it's interesting to me, changed its name to WPATH, which stands for World Professional Association of Transgender Health. And this organization has been blasted by its colleagues and peers because of its 19 guidelines, which only 3 were mildly scientific. The rest were completely ideological, social, political ideas. Many experts like Dr. James M. Cantor and Dr. Kenneth Zucker rejected their 19 guidelines for transgenderism, and these people were demonized. Dr. Zucker, we can talk about that later, who worked in Toronto, came H and was a professor at the University of Toronto, was fired and his work was demonized, and he eventually sued the Canadian government and won, and got an official apology and $586,000 for reparation. Same thing's going on with Jordan Peterson. They're trying to take away his license because he's speaking out regarding the anti-scientific studies, the junk science that the trans activists, trans doctors are promoting. The last person, just quickly, would be Dr. John William Money. This guy was a complete monster. He experimented on 2 twin boys by the name of John. What's their name here? John and Brian. One of them had a botched circumcision, and the parents took John to Dr. Money, and he recommended that he do reassignment surgery and that he live like a girl. It destroyed the boy's life because he would rip off the dresses that his mom put on him. Hated going to see Dr. Money for counseling. Eventually, both boys took their life as adults because of the trauma that this guy put them through. Just sexualization, pornography, acting out, masturbation, and showing them pornographic pictures, trying to sort of force the one twin to be a girl. And he always knew that he wasn't that. His family knew he wasn't that. He obviously later on detransitioned, but both twins killed themselves because of the trauma that they experienced from this doctor. You'll never see Dr. John William Money listed, even though he was a pioneer because he did many reassignment surgeries and recommended hormone therapy in LGBT literature because of the abuse that he did in the scan around these two twin boys. So those are the three sort of musketeers, along with their German counterpart, which I mentioned there earlier in Germany, that were actually doing sex reassignment surgery early on, from the 30s to 50s to 60s. They were considered quacks. Some of their other ideas regarding some other ailments were completely bizarre. It was complete junk science and medicine. But this is where the trans movement comes from a point of insanity, junk science, and today they're perpetuating that. So that's just a little bit background on that. And there's all kinds of modern day psychologists, sexologists who will refer to these people and the devastating history and abuse and molestation of children and adults that they engaged in. That's a little bit of the background that I'm aware of.
Okay, all right. Yeah, very interesting. Oh, I was going to turn it directly to you, Marvin. Because, what do you make of some of the history and the studies that have been done? Go ahead and take it over.
I think what I would like to do is I would like to introduce three frameworks through which we can think about trans issues. Okay. These are from a clinical psychologist called Mark Yarhouse, who's a Christian psychologist. The first is what he calls the integrity model. The integrity model views transgender issues through the lenses of the sacred integrity of maleness and femaleness, stamped on one's body. Attempts to cross gender boundaries, such as cross-dressing or sex changes, are said to violate this sacred integrity of a person's given sex. Adherents of this model would maintain that a person who experiences gender dysphoria, trans people, should accept their biological sex as one of the givens of life from a sovereign God. Any attempt to manage the symptoms of gender dysphoria would be seen as a violation of the sacredness of their maleness or femaleness. So I suppose you could say, if we put this in political terms, you might say that this is a sort of an extreme right. Not that it mapped out to that, but this just sort of gives a conceptual framework in our minds of how to understand these ideas. A second framework that Yarhouse introduces is the disability model. In this model, it's a second framework often utilized. Here, the experience of gender dysphoria is seen as parallel to other mental health disorders, a result of living in a fallen and broken world. The experience of gender incongruity is not chosen, okay? So we're not condemning people. It's not chosen. It's seen as morally neutral. But it is also clear that the experience of gender dysphoria is not what God originally intended from creation. So that's the second model, where this is somewhere where I fall, I think. And then you have a third model that he employs, which he calls the diversity model. It's quite different from the previous two. This framework sees the transgender experience as something like other forms of diversity, something to be embraced, celebrated, and part of their identity. There are no moral overtones in this model, and those who work out of this model would likely object to the terms dysphoria to describe their experience. Advocates of this model would see gender fluidity as something positive, and few, if any, valid gender distinctions. Okay, so I like to think of these issues falling within those frameworks: the integrity, the diversity. I forgot the second model. The disability and the diversity model. Yeah, thanks, Joe. So I like to look at it like that, and I think occasionally we sort of dip into each of these models in one way or another. Christians tend to operate from the first model, the integrity model, but I'm sort of very open to the disability model and sort of accepting the idea that some of these things, particularly trans issues, are caused by the fall, which none of us are going to disagree with. But what I'm trying to say is that it's sort of humans functioning in a way that they shouldn't, just as if they had some other kind of ailment or sickness.
Yeah, I think medically, for most of history, like trans or gender dysphoria was seen as an actual disability kind of thing until very recently. So, yeah, Jaime, I just want to bring you in here. Mark,
so it's gone to the diversity model, right, which is a sort of a celebration of the well, you couldn't use dysphoria amongst those people. You'd have to say gender fluidity. So there's a celebration of that fluidity.
What, out of curiosity, but just before I bring Jaime in, because Jaime mentioned some of the scientific studies and that sort of thing. So I'm just sort of curious, where do you think the science is based on the studies? Like which model best fits the scientific data that we have so far?
I'm not sure it's clear because, for one, I don't think science has really worked out what the cause of the problem is anyway. I say problem, right? What the cause of the issue is anyway. Some sort of hold to brain sex theories, others to sort of behavioralist theories. So I think the science is pretty much some, hold that it's an endocrinal imbalance. Some hold that sexual organs develop before the part of the brain that brings about sexual identity in men and women, which is different. So I think it's all over the place, and I don't think we know.
Okay. All right, Jaime, what do you make of these three different frameworks to understand these issues? And
I completely agree with what Marvin said. It's a complicated issue. Nobody is denying, we're not denying that gender dysphoria does not exist, that same-sex attraction, gender confusion exists. I guess the big issue is that many of the experts, leading experts in this field, whether it's Dr. Paul McHugh, some of the current experts in the States, and others, are now changing their mind. Some of the current psychologists are changing their mind regarding this. Not that gender dysphoria exists or same-sex attraction exists, but whether hormone replacement therapy and reassignment surgery is doing more harm than good. I think that's the big issue, especially minors.
Very good point. Very good point.
I think that's the big issue. I have a list here of probably, I don't know, over 50 experts in the field. Most of them are not Christians, from Finland, from Sweden. I can't pronounce a lot of their names. Dr. Olia Sauter, Dr. Marcus Evans, this guy from the UK here, Marcus Evans, and others that are saying that there's different groups here. In the past, it's mostly been adults, mostly male, female, in some cases female to male, but more male. And now it's children whose brains are not even fully developed to make a rational decision. And so I think that's a big issue. Marcus brought up an excellent point, which many of these specialists now in Scandinavian countries, by the way, this is part of the history that, which a lot of people might not know, is that these European, Scandinavian countries like Sweden, Finland, Denmark, Netherlands, they were the pioneers in this. They were doing this 20 years before we ever did it. So people here in the United States were referred to the clinics there because we had no clinics here, right? And now many of these countries are doing a 180-degree turn, especially on minors, prescribing them hormone therapy and reassignment surgery because, like Marvin well said, we don't know the long-term side effects, right? Something that the LGBT plus community does not want to talk about, and there's many cases, and they will say there's none. So the line and intellectual dishonesty from this community has always existed, and now it's sort of at its height, where the train has fallen off the rails when it comes to common sense and science, is that there are many people who are detransitioning, who have sex change regret. And there's all kinds of stories. There's a celebrity, Chloe Cole, who's all over the internet, but there's many, many others all over the world who are detransitioning, and they're being demonized. How about their rights? You know what I mean? They made a mistake because the doctors misinformed them. They transitioned too early. But Marvin made a great point, which what I would like to talk to is many of these experts from Sweden, Finland, even here in the United States now, are saying that we're treating the wrong symptom, that the majority of these minors have other underlying mental issues that need to be treated that could be causing the transgenderism. We don't know. For instance, trauma with PTSD from sexual abuse and other negative experiences is huge among transgender minors. Most of them are on the autism spectrum. There's personality disorders and codependency disorders. There's low self-esteem and severe clinical depression. There's psychotic symptoms like, and there's also bipolar and schizophrenia, self-harming, bulimia, and anorexia, and defensive gender attachment. So there's all kinds of other independent mental health issues that these minors have that are not being dealt with, and by assigning without investigating these through counseling, these other mental independent disorders, but by just trying to assign a quick fix to gender reassignment surgery or hormone treatment, which I want to talk about later, has bad side effects, especially minors, is irresponsible. It's unethical. It's abusive. So I just want to add that to what Marvin said.
I know this isn't in the list of questions, Jaime, but just very quickly, I'll get you both of your guys' take on this. So I'm wondering, in terms of like the three models and kind of making sense of this from a scriptural standpoint, do you think, based on the Bible, there's any clear way to understand this? Is it the disability model, or is it the integrity model? Like, what do you think Scripture says on this issue? Very quickly.
Are you asking me or Marvin?
I'm asking you first. And
yeah. Okay. So that's one of my specialties is disability theology. So that I can speak with quite a bit of authority is, and I've spoken to clinicians and Christian clinicians, psychiatrists, people that work with people with disabilities. I used to work with people with disabilities, intellectual disabilities, people who were duly diagnosed, so they had, for instance, an intellectual developmental disability, but they also had a mental health disability. That's what's going on here. These people have gender dysphoria, but what is causing the gender dysphoria or same-sex attraction? Is it the transgenderism or gender dysphoria, or is it one of these other underlying mental health issues that they also have, which they refuse to deal with? So this is the dangerous part. They're refusing to get counseling and treatment for these other issues, which could be producing the gender dysphoria and same-sex attraction. We don't know. Obviously, there must be some kind of interconnection, right? But related to your question, disability, and I think Marvin mentioned the fall. It's obviously because of the fall, because of sin, that we live in a broken, sinful world that's not perfect, and that's distorted, and it's being corrupted. And so disability is sort of a offshoot of that. But again, we have to be careful with that, because we know from John 9 that Jesus said that this man's blindness was not because of his personal sin or his parents' sin, but for the glory of God. But that doesn't take away the fact that he was born blind in the first place because of original sin, right? But he personally, the example is this: if you get intoxicated, right, and you go out and drive your car, and I had a friend growing up in church that did that, and he lost both his legs, and that would be a result of his personal sin or his bad decision of getting intoxicated, getting behind a car, and he lost his legs. But he wasn't born that way. So if you're born with no legs or no arms, like Nick Vorchik, who I know, then that would be a cause of original sin, not personal sin. But in the case of my friend Bob, it was a result of personal sin because he got himself intoxicated and then drove intoxicated, smashed into a wall, and lost his legs. You see the difference?
Yeah.
So in this case, for the most part, as I see it, it would be a part of original sin. But I think there's also personal sin because of social media. Because just because you have gender dysphoria or same-sex attraction doesn't mean you're going to be a transgender. Because we know that 80 to 90% of kids outgrow this fad, right? So they have gender dysphoria, but they embrace their biological sex. I've known many people who have same-sex attraction, but they don't identify as homosexual. It's just like you might deal with lust heterosexually. You know what I mean? But you don't identify as that. You know what I mean? It's just something you struggle with. It's not something you embrace. It's something you fight against because you know it's a part of original sin. It's not in your best interest because it has negative results. So, like, we're affirming original sin. We're affirming a degenerative nature. We're affirming our sinful lusts and impulses. That's not something beneficial, and it doesn't have beneficial results. So I think that's a little bit what Marvin might have said.
Awesome. All right. Marvin, I want to bring you in here on this scriptural question and which model you think the Bible endorses. But I have an additional question as well on the scientific end. It's something that I've struggled with it myself. I don't know exactly what the perfect answer is apart from going to disability and consequences of the fall. But this issue of chromosomal hermaphrodites, where they so do you want to give your take on the hermaphrodites, but also, scripturally, which model do you think is best?
Well, I'll begin with sort of saying that the integrity model seems to be the one that is most natural in the reading of the Bible. In Genesis 1 and 2, God created two distinct genders with differences. He said the two will become one flesh. Also, Matthew 19:4, God made male and female. Okay, so there's another scripture that people sort of some adherents of the integrity model use, which is the effeminate shall not inherit the kingdom of God. Those who would go towards a diversity or disability model might try to make use of the Ethiopian eunuch, who was saved after his conversation with Philip, to show that God does not sort of favor one gender or no gender, or there's no problem. There's no problem with gender, but I think that's quite a misrepresentation of the particular scripture of that Ethiopian eunuch. So I would still say the integrity model seems to be the one that is most straightforward in scripture. But of course, we need compassion. Yeah, we need to try to understand that some people actually are transgender. And which segues nice into your second point, which was about intersex, right? I mean, intersex people are intersex, and as far as I know, not transgender. They have an understanding of what they are, and we follow what they are. So I know a lot of kind of skeptics will throw that in as thinking, it's a gotcha, but it's not. The more you look at it, because intersex people are intersex, and they choose which sex they are because we don't know, and only they know because of chromosomal abnormalities brought upon by a few sort of genetic conditions that can occur.
Gotcha. Awesome.
So, so basically, the skeptics are sort of making something out of nothing because I think
Mountain out of a molehill.
a very, very large percentage of what's the word? Intersex people are not confused about their identity. They choose one.
Yeah.
Or let me put it another way: they inform us of who they are.
Gotcha. All right. Awesome. Yeah. Thank you for addressing that. Because I know, me and Marvin, we know, atheists like Sarah on Skeptics and Seekers, they brought this up because they have their trans friend, Rainbow Peter. If you're listening, hey there.
Hi, Sarah. Hi, Rainbow Peter. Yeah.
Yep. He's brought up that same issue about the eunuch there. So, all right. Awesome. So, Jaime, going to you, the next thing on your list is kind of focusing on not transgenders themselves, but the transgender movement kind of thing. And you mentioned that the movement has these various contradictions in terms of the terminology that they use and the outcomes that they're looking for. So, do you want to kind of explain what do you mean by the transgender movement and the LGBTQ? They have these contradictions with the terminology.
For sure. There's something that Melvin mentioned that I don't know if I would agree completely with. He said that they are transgender. I have an issue with the term transgender.
Mm-hmm.
I think it's an oxymoron. I think it's linguistically not accurate. I think it's philosophically not accurate because we believe in the integrity model, which would mean you are either a genetic male, genetic female, biological man, biological woman, a physical man, physical woman, whatever term you want to use, that the term transgender together is contradictory, philosophically, biologically, because gender is not transitional. So when you say there is such a thing as a transgender, well, it's still a real man dressed up or presenting as a woman. You know what I mean?
Mm-hmm.
And regardless if you castrate or mutilate your body to try to represent that, you're still not changing the internal organs. Females and males have different organs. We have different brains. We have different muscle mass, right? Different body structure.
Mm-hmm.
And some of these brain studies are highly subjective. I mean, their own colleagues within the LGBT community have criticized them as being junk science.
Mm-hmm.
So there's no conclusive evidence. There is conclusive evidence that hormone replacement therapy and gender reassignment surgery do have negative side effects. They produce cardiovascular, heart, and bone disease. They can produce that, blood clots, brain damage, osteoporosis, even IQ and mental disorders.
Mm-hmm.
So, I mean, this is not me saying this. This is the experts on their side from Sweden and Finland. So that's, I have an issue with the term transgender. They have other made-up terms as well. It was on Piers Morgan, who's one of the probably most, one of the strongest defenders of the LGBT movement, gay marriage, gay people, and trans people. And he's now being attacked and trying to be canceled by the woke leftist radical trans movement, just because he will not accept the fact that you could be fluid gender, or that there are 100 genders, or that you can identify as a subspecies, right? So it just doesn't stop with transgenderism. That's the contradiction beyond the term. Now it's going into the LGBT plus, where you could be a trans ager. You can identify 6-year-old man can identify as a 12-year-old girl. You can identify as a cat or dog. You know what I mean? So anyway, go ahead if you want to respond.
I was just going to say I'm going to acquiesce on that point. And Jaime is right. I should have said there are some people that suffer from genuine dysphoria. Okay, gender incongruence.
Yeah.
You might say that I might say that that's in their own mind, but in terms of a political, nonsensical uh, nomenclature, Jamie's correct. I'll
Okay, so
agree with you.
Yeah. For instance, I just want to add something. They call me a cis man, and they call Pierce Morgan
Yeah,
that. I don't
yeah.
consider myself a cis man. And by the way, a cis man means basically you're heterosexual and you identify with your.
Your gender and sex align. Yeah.
Yeah. Well, I don't. Like Pierce Morgan said, I agree with him. I don't, and I hope you put those videos on there. I don't identify as a man. I am a man. So
Mhm.
I have an issue with gender identity, that term. I have an issue with gender expression, that term. I have an identity with affirming gender care, because I don't think it's affirming. I think it's abusive. And I have a term with the term. I have an issue with the term cisgender, transgender, and then they say there's 100 other genders, the LGBT plus community. So now they're self-destructing themselves from within, because the lesbian activists have a huge issue with men presenting as women, trying to invade their gender. There's the washroom issue, the issue with sports, where biological men are competing with biological women. So
Yeah.
it's gone off the rails. It's gone from these quack doctors now even further into the realm of insanity. So people within their own community, there's trans people within the community that are saying, now my job, my livelihood, I'm being mocked because of your you continue to add letters, right? And gay people said, we never signed up for this. There's a whole organization called Gays Against Groomers, who are against the radical trans movement, in trying to indoctrinate young kids from the age of 5 to the age of 17 with this radical leftist, I call it Marxist gender ideology.
So, Jamie, I just want to come in here because we're in some trouble. So we actually do have someone from the transgender and LGBT mindset in the audience, Matt W. And he's saying, look, I thought this would be a measured discussion. I was wrong. This is just Christo fascist garbage made for smooth brained. I think he means straight brained. Yeah. So he's in the chat. He's very miffed. I just want to turn it to you guys. Like this kind of thing, obviously our goal, we are trying our best as Christians to come up with the truth based on all the data that we have, scripture and the scientific data, that sort of thing. But yeah, do you guys want to kind of engage with Matt? And I know this kind of relates to another aspect where when people have differences of opinions, when it comes to LGBTQ, there is issues of bigotry or hate and intolerance. So I thought this, bringing up Matt's point here, would be a good way for you guys to address this issue of tolerance and versus being intolerant.
I'll respond to it first. I would like to apologize to Matt. Please forgive me if I said anything to offend him. That was not my intention. I'm not against gay people or transgender people. I'm against the indoctrination of minors who don't have the mental capacity to be able to make these decisions until they become adults. I want to make that very clear. I do have issues, I guess, with the language, because I think it's philosophically contradictory, scientifically contradictory. So it's interesting the terms he used there, because it's not helpful when people throw out those terms, and I apologize if I threw out those terms, but many people, even within the LGBT community, find the radical trans movement fascist and hateful and intolerant and bigoted, because we're allowed to disagree. So disagreement is not discrimination. I want to make that very clear. It's a form of diversity. The truth is intolerant and is exclusive by definition. So we're trying to have a respectful conversation. I'm not demonizing trans people or gay people. I have friends who are gay and trans. We are trying to expose the radical fascist leftist agenda that would try to exploit minors. We're not talking about adults.
As for me, I can't really understand what he's trying to say. I think if he were to wind the rhetoric in a little bit, we might be able to kind of have some kind of exchange, but I just don't know what he's trying to say,
Fair
and
enough.
that's not that helpful,
In general, though, Marvin, what do you? Because this is one of Jamie's points that he wanted to raise about the movement. There's all this issue about being tolerant these days. For Christians are intolerant, we're bigots, and all this stuff. But what about on the other end? What about the bigotry and hate that we're getting? And frankly, I'm seeing.
I mean, Christians are intolerant, and these are just memes in my in my view. And I had this conversation with David on the board last week, which is, I'm in China, I'm the Christian amongst atheists, and I'm the one asking for tolerance for LGBTQ plus, right? I'm the one asking for them to be tolerant and not so vociferous in their dismissal of those people who live alternative lifestyles. So I just don't even think it's a fact. I just think it's just rhetorical points.
Gotcha. Okay. And I just want to share something too, as a philosopher and stuff. I think this might be helpful. Look, when it comes to tolerance, some kind of moral principle of tolerance, there used to be this classical principle of tolerance. That's what all three of us, I think, would hold to as Christians. Whereby, look, we are told to tolerate people who disagree with us or have differences of opinions. Look, everyone has sinned and fallen short of the glory of God. So yeah, I can respect that you have a difference of opinions, and then I'm willing to engage substantively, provide reasons as to why I think I'm right, and consider your reasons as to why you think you're right. So this is that classical principle of tolerance that I think is moral. But unfortunately, today we have the modern principle, which is essentially, if you don't agree with me, Mr. Christian, you're a bigot, you're a homophobe, you're a transphobe. I'm sorry, shut up. That's not tolerance. That's intolerance by definition.
Yeah, well, they're being Christian phobic, they're being conservative phobic, they're being Islamophobic, they're being philosophically phobic. You know what I mean? Bible phobic. So it's interesting that the acronym DIE, DIE, diversity, inclusion, equality. It's a two-way street. And it seems to me that the radical left, and I would also accuse the radical right, okay, so let's be fair, because I've heard them use demonizing words like hate and bigot and intolerance where it's not appropriate. So I think we have to look at people's actions and not attack the person or the ideology. We can attack the ideology. That's what we're doing here. We're not attacking gay people or trans people. We're attacking the ideology that is irrational, unscientific, and abusive. And that goes for the right as well. I don't consider myself a conservative or a liberal. Or even a Christian, because that's being abused. I consider myself a follower of Christ. I'm an independent politically. So, so it's a two-way street. All these diversity, inclusion, not a one-way street.
I have friends who are LGBTG, not T yet, LGBTG. And I get on with them absolutely fine. There's no issue at all.
Yeah.
But if you're asking if somebody's asking what my opinion is on the issue, that's something that I think that can be separated from the person. Right? I don't feel that I'm attacking them. I'm not trying to attack the person themselves. I'm trying to sort of address the philosophical framework, the worldview from which they're operating and which they're carrying out. In the same way, I would hope they do the same to me. I'm very happy to have my Christian worldview scrutinized, and they too also ought to do the same. As you and I both know, Dale, from talking with a lot of skeptics, how much time do you spend actually asking them to stay on point and not get embroiled in ad homs and bickering and arguing? I must spend 90% of interaction and say, look, get back on point. And basically, that's just what the Matt W did. But so I've sort of had enough experience that I would kind of dismiss it and say this guy's not ready for a conversation.
Yeah.
That's how I'd cash it out.
Gotcha. All right. Awesome. So, yeah, I think the other thing. So, Jaime, you mentioned that there are three negative connections with the trans movement. So I'm not sure what.
Yeah, and I'm a little hesitant to mention them now after that last comment because I'm not trying to be hateful. They don't even come from me. They come from other sources. But as a Christian, I think we have to acknowledge the hard fact of some of them. So I'll just list them quickly and let you think about it. So the first connection is that the LGBT community has always been connected to mental illness. I know they removed it because of the stigma, but they didn't move it for scientific reasons. They removed it for political reasons, for ideological reasons. So many experts on the issue say it's still a mental health issue. I've researched this quite extensively, and I'm not going to get into it, but I went on their own sites, so their own studies. So they admit, the LGBT community admits that they have the highest rate of depression, right? They have the highest rates on every level, right?
And suicide as well, I think.
Yeah, so they admit that, right? So that's the one connection, and I don't need to read off. I mean, it's their organizations I have here on paper that admit to that, and now they will accuse us of we're guilty. It's our fault that they have mental illness. It's their fault they're committing suicide because we're not accepting them. And that's complete philosophical suicide. Because, I mean, Christians have been probably the most persecuted group of people on the face of the planet. We have the lowest rate of mental illness and suicide. So are we saying, oh, because you persecuted us, now, we're going to kill ourselves? I mean, it's blackmail. It's psychological blackmail. I mean, we've already established, the experts have established that there's dual diagnosis here. There's multiple independent mental illnesses that these kids and adults already have, along with their gender dysphoria or same-sex attraction, which are not being treated, right? So they're at their own admission. Gay Pride admits this. I mean, they have seminars that they have the highest level of mental health disorders. Secondly, the second connection would be to philosophical contradictions, and we talked about that already. How it's philosophically contradictory. A lot of things they're saying, be inclusive towards me, but they're not inclusive towards other people. Be tolerant towards me, but they're not tolerant towards other people. Be accepting towards me, or you're hateful and bigoted, but they're not accepting towards other people, right? Towards Christians like us. And then the last one, which I hate to bring up, but I like to get Marvin's take on this. And I sort of knew this, but I hate bringing it up because it is a form of demonization in a way, but demonization is real. So, and we're talking about Satan himself. As Christians, we believe in Satan. We believe there's a real person called Satan and the devil. And it was Ben Shapiro who first brought this up regarding the Satan Con festival in Massachusetts, which is a part of the Satanic Church. And I have it here documented on 6 papers where the leaders of this organizations, the founders, they own the LGBT community. We invented it, they're saying. The majority of our members are gay and trans. We were celebrating Pink Mass before it ever became legalized, where we celebrated through Pink Mass gay marriages and transgender unions. So the founder there, Lucian Greaves, I mean, I can go on to quote him where he says they will fight to the death for the gay community because it's a part of their community and it's inherent in their community, and they're against. Again, he calls us bigots and homophobes, and those people, they need to be brought down. So they admit that this is part of their community. As far as the Bible goes, theologically, Marvin can talk to that, but the Bible does say that the devil is the god of this world, the system, the ideologies, the secularism of this world. The devil is the creator of that. The Bible says he's a liar and the father of lies. The Bible says that the devil has deceived the whole world. So theologically, whatever's of the world, the lust of the flesh, the lust of the eyes, of pride. Notice the pride of life, and they call the organization Pride. It's not of the Father, but is of the devil. So theologically, anything that's of the devil, secular morality, is satanic. And now the founder of the Satanic Temple, which is different from the Satanic Church, by the way, they don't even get along, which I find it's ironic, is saying that these people are inherently part of their community. It's part of their Pink Mass, and they will fight for them to and this is normal, and they accept this and they celebrate this. So I just find that kind of interesting.
Mm-hmm.
Awesome.
Good
Yeah,
point.
Marvin.
Good point. I think speaking to what Jaime said, I read some theologians say that, well, why did God invent sexuality in the first place? Right?
Yeah.
It could go wrong. And he addressed it like this: that the need to be with another, a male and a female, ensures that humans build communities and societies as opposed to just being individuals. If we didn't have that drive to be with a partner, and since it's such a powerful intrinsic drive, it is one that is ripe for corruption in the hands of an enemy.
Right. And doesn't the Bible say that the devil masquerades as an angel of light? So
It does.
he basically counterfeits everything God does.
Mm-hmm.
So where there's true gender, he's going to create false gender. Where there's true Christianity, he's going to create false Christianity. Where there's true Christianity, sexuality, he's going to create false sexuality. That's his job. He's a counterfeiter.
Yes. Mm-hmm.
All right.
Absolutely.
All right. Awesome. So I think we have actually covered on this. Jamie's already kind of briefly mentioned it, but the sixth topic that you wanted to go over, the final one here, was about the U-turns that countries like Sweden and other European ones are taking in terms of gender affirming care, especially for minors in particular. So, yeah, Jaime, do you want to take it away on
Yeah,
that?
I've already sort of mentioned it. Like Anne Weiner, she's a clinician consultant from Oslo University in Norway, says there's no research on the negative health consequences of gender affirming care for minors, and it's experimental treatment, she says. So they're looking to reverse it. France is reevaluating it. England is also reevaluating it. Psychiatrist Dr. Mikael Landin from the Sweden National Board of Health also says, in hindsight, we should have not affirmed people's gender. And these are people they're not Christians. These are people who worked in clinics. He says experts in Sweden and Norway have stated that 6% have a complex and severe independent mental disorder that needs to be dealt with. You see in the UK, Marcus Evans, who's a psychiatrist leading in this issue, also says we have not solved the root problem, but are giving it a quick fix. There's no long-term research study for the long-term effects of hormone blockers on minors. So he says, what's going on? We don't know. We are acting as we do know. And he says it's wrong to affirm youth who just seek help for gender dysphoria without dealing with the other underlying mental health issues. Swedish endocrinologist Ola Solda said the same thing. They're reversing it in Sweden and Finland and Denmark, Australia. 20 states now in the United States is banning it being taught in schools and trying to block hormone therapy. There's an excellent, I hope you post that, there's an excellent, the Florida Medical Board, they interview this one lady from Sweden who's an expert on the issue. I can't pronounce her name. You can see it if you could post that, Dale. And she talks about her hesitation and how it's not making it better because 10 years after reassignment surgery, severe depression hits, and it hits over 50% from their counterparts. It's even higher at that rate, 50% from their counterparts. So it doesn't seem like it's getting better because they're not dealing with the real issues, which are other underlying mental health issues, which could be causing the same-sex attraction, which could be causing the gender dysphoria. We don't know. The studies are unconclusive. The studies that the one guy did, Simon LeVay, I think he is, and he's openly gay, by the way, have been torn to shreds by his colleagues, saying that they're junk science. So anyway, that's some of the things I want to bring to your attention. That these countries are ahead of us by 15 years, 20 years, and they had the first gender affirming clinics, and they were the first to do gender reassignment surgery, and now they're backtracking when it comes to minors. because we really don't know the side effects. I mean, there was a minor, I think, in Sweden that died during the operation. Another one who got osteoporosis. We know that cancer and heart disease and bone disease and other, they're not, testosterone is for men, not for women. We have different bodies, right?
Yeah.
So,
Good point.
so that's interesting. Yeah. Also, the bathroom issues. I don't know if you want to touch on that and sports.
Yeah, I was just going to agree with you, Jamie, and say I read today a report says that as by the time children or young people are 18, well over 80% of them sort of no longer feel dysphoria.
Yeah, some of them say 90%, Marvin.
So I've read, actually, you're right. It was minimum 80%.
Yeah.
For women. For men, it might have been higher, like 100% in one study that I read. That they, well, I'll wind back on the 100% because let's say 90%. Okay. So these feelings of dysphoria dissipate by the time, or are resolved by the time the adolescents have hit sort of 18. So the more invasive the intervention up to that point, the more damage has been done, which is irreversible to that individual. And this is a very, very controversial issue. For example, for those who would be totally in the diversity model, go straight for reassignment at, say, age 13, 14, what happens if that young adult gets to 18 and says, I no longer feel this dysphoria?
Yeah, Marvin, that's an excellent point because it's all over the internet. It's all over the internet, but now there's lawsuits against the doctors from kids who transition at 14, 15. Now they're in their 20s. Chloe Cole is one of the leading celebrities, but there's many, many others who are now detransitioning. So nobody wants to talk about that. How about their rights? They made a mistake.
Mm-hmm. And kids too, right? Yeah. And even worse, in some places, I think Canada is one, they sort of took away parental rights.
Right.
For the parents to sort of say what can be done in terms of medical intervention in the child. And I think the doctors were able to do intervention on the child without the school, without the parent knowing, and the school was allowed to counsel the student without the parent knowing. So basically, the state has intervened to the point where, 1984, what is it?
Yeah.
And this is a recent case that happened in Canada. The father was told not to speak about it. He did speak about it. He was imprisoned for a while and was threatened with 5 years imprisonment. I try to remember his name. It's something like Hoogland, Hoogland, I think. They let him out in the end, but man, it's 98 dystopian stuff.
Awesome. All right, cool. Well, I think that covers it in terms of Jamie's questions. Let me just go to each of the guests before we go to audience questions. Marvin, starting with you, is there any topic about this issue that I haven't asked you guys about or that you think is really important?
No, I think your questions are good. You've covered it.
Okay. Jamie?
Yeah, I don't want to get into it, but the whole washroom issue is a human rights issue, especially with religious women like Muslim women or Jewish women, because they're not allowed to be in the washroom with biological men. So what about respecting their religion and their beliefs? And then the whole sports things where, women are being traumatized, even in teenage girls sports where, there's a guy. Don't forget, a lot of trans people are not transitioned, so they're a biological man, and they're in the showers with young girls. All kinds of stuff like that. That is completely a human rights issue. I just wanted to bring up though, when I was going through this with my son, there was a book recommended which is fantastic. He's an expert on the issue. Yes, he does happen to be a Christian. His name is Dr. Marvin Wong. He's a PhD clinical psychologist in California with over 30 experience working in the secular field. He wrote a book called Raising Gender Confident Kids, and he documents and demonstrates how gender dysphoria, along with same-sex attraction, for the most part, because there's many factors, can be attributed to social conditioning. He shows how there's no such thing as prenatal memory for infants, so you can't be born that way. And between 1 and 3 is when you sort of acknowledge your gender. And he talks a lot about something which is very interesting to me, is the whole defensive attachment and codependency, where it's seen more in young boys because boys have to detach from the mother, from the maternal bond to the paternal bond around between 1 and 3. And when that doesn't happen, it can cause same-sex attraction or gender dysphoria when the father's not absent, or where there's sexual abuse, or where the mother may be overbearing, right? And that detachment isn't made from the maternal to the paternal. So in girls, it can happen more in their teens when they don't have that proper relationship with the father, and they see the father as being abusive. It can, not in all people, in some people, trigger those inclinations, and then eventually lead to open homosexuality and transgenderism. So he well documents that, the whole prenatal thing, the whole attachment, detachment, codependency at an early age, and the whole role model things, and how kids interpret that in their brains, right? How that we already know. The studies are there show that does cause gender dysphoria and same-sex attraction.
One thing
in some kids. Let me correct that.
One thing I'd like to add, just before we go to the 3 audience questions here, we've mentioned about studies and stuff like that on human beings, but in terms of this aspect of it, social, gender is just a social
construct,
cultural and socially.
Yeah, they call it a social construct.
Yeah, that's the word I was looking for.
Yeah.
But there have been studies in animals that obviously lack all of this stuff. So, for example, in chimpanzees, and they have discovered this. I guess it's kind of support for the integrity model that Marvin was talking about earlier. Male chimps are attracted to certain kinds of toys or tasks and stuff, whereas females are attracted to others. So even in the animal kingdom, there has been some studies supporting this notion that there are these 2 genders and stuff. So yeah.
And Dale, can I just say one final point, very short, but it goes along with what you said, because this is very important. So they talk about the spectrum, right? That there's 100 genders now, which is ridiculous, right? Mm-hmm. And that you could be fluid gender, you could be non-binary, whatever that means. That means you don't identify as any gender, right? Mm-hmm. And then it goes beyond that. You can identify as a species, or you can have a different age, or a white woman can identify as a black woman, or just ridiculous things, right? Yeah. But it's an attack. So I don't believe there's a spectrum in the genders. I think there's only 2 genders. But I think there's a spectrum of diversity within the genders, and that's very important. So within the male gender, there's a spectrum of diversity. Within the female gender, there's a spectrum of diversity. Almost like dogs, there's different kinds of breeds of dogs and different kinds of breeds of cats. So within the spectrum of malehood, there's different kinds of men. There's men who are masculine. There are men who are more feminine. There are men who are more soft. There are men who are more
creative people.
And within the female spectrum, it's the same thing. You have women who are more butchy, or women who are more feminine. But that doesn't mean you can switch. You're still a woman. You're just a more feminine woman or a more masculine woman. You're still a man. I mean, and you see that, like with someone like Fred Astaire, for instance. He was a tap dancer. Or people who were into ballet or gymnastics. They're not gay. Many of them are heterosexual, right? Mm-hmm. Yeah. So you could be a lumberjack, and you're still a man. You could be a dancer, you're still a man. So it's an attack on the diversity of the genders. This is very important. There's different kinds of men. There's different kinds of women.
I was thinking this the other day. I was thinking, well, okay, so if there is really no sort of difference between the genders, it's argued sometimes on the board, and they'll say, well, some women can beat men and things like that. So I was thinking to myself, okay, so why don't they do this? Next time there's a domestic violence case, mm-hmm. and they bring it to the courts would say, well, no, it's not domestic abuse. It was a fair fight. Right? Exactly. Which is obvious nonsense, isn't it?
Yeah.
Yeah, it's nonsense.
Because we know
Yeah.
we know the male is stronger, right? It's
Exactly.
just
That's a great point, because Jordan Peterson demonstrates that by saying there's more men who are engineers, there's more men who are in prison, right? There's more men who are murderers, right? And then there's more women who are into healthcare, right? So yes, there's differences, but there's also between men and women, like biological differences, physical differences. But there's also diversity within the genders themselves, right? But a dog is a dog, whether you're a Chihuahua or a German Shepherd, right?
Mm-hmm.
Just because that Chihuahua is more feminine or small or softer doesn't mean he can identify as a rat or a groundhog, right?
Exactly.
So it's an attack on the diversity of the genders, which is
okay.
It's sad.
Here's another thing that I thought about. I'm going to write this up down. It's this. Look, if you're a substance dualist, right, I can conceive that you could be born into a wrong body.
Oh,
I can conceive it, right? But
I
if
was
you're
ask about this, believe it or not.
if you're a physicalist, how can you be anything but your body? Right? That seems to erase or really damage the case for transgenderism or gender fluidity or whatever.
Yeah, that's a good point.
Well, here's we actually have a question in the audience. So I unfortunately I can't show it up because he uses some language that I'm not going to put up on the screen. But he kind of taking what he says. There's an interesting question here because we've been kind of assuming that gender is kind of a physical aspect. But for example, God is described as a he. He has that pronoun, but yet he doesn't have a physical body. So I wanted to get your guys' take. Is gender really a physical thing? Is there such a thing as a male or female soul, or can spirits be gendered? Like, what's your guys' take on that? Marvin, we'll start with you.
Well, I think God is neither male or female. I think we refer to him in certain roles as he. So I don't think angels are supposed to have gender. I've never sort of given that too much consideration.
I thought angels were male, like Gabriel and Michael.
That's a good point, and it does say as well, doesn't it, that some angels sort of left their habitation and sort of
commingled.
Yeah, commingled. So I suppose that would make them male. Good point. Yeah.
Okay. Jaime.
Yeah, that's a difficult question to answer. I'm not going to answer it with complete certainty because I don't think I know. But my take on it would be because God created man first. You know what I mean?
Mm-hmm.
Yeah.
He created Adam, and there's a role there, right? It doesn't mean that men and women are not equal, but there's different roles.
For sure. I'd agree with that.
But I've heard my pastor, who's a conservative years ago, I mean, he's a Baptist evangelical, very conservative, but he says, don't stone me as a heretic. He says, I'm just saying, this is what I think. I'm not saying this is Moses coming off the mount, but he says the Holy Spirit, in one sense, plays the role of a female because it's comforter, and that's what a woman does. I'm not saying that Holy Spirit is female because it's a part of the Trinity, and it's God said, let us create him in his image. But so you can be a man and have female maybe characteristics like being comforting or sensitive, and you can be a female and also have masculine characteristics. But that might be more of a social construct. But again, it doesn't take away from the fact that there's diversity within the genders, but you're still stuck in that gender. You can't, that's why, in my opinion, transgender is an oxymoron.
Okay. All right. So this question comes from a Christian, and he's quite adamant. God is definitely a male. I mean, think about it too. In the incarnation, Jesus incarnated as a male.
No, I agree. He's a male.
Okay. All right. So he's asking, long hair Miss Wybrow asks, so God made man and women. For many years, there were just two genders and still is. And that has not changed. But man had to change things, and it's unjustifiable in God's eyes. shame on humans. So I think the question that I can glean from this is there an element, the whole transgender movement, is there an element where maybe part of this movement that we're seeing is due to sin and this need for human beings to latch onto the newest thing and just have change for change's sake? Is there any element in that wrapped up in the transgender and LGBT movement, do you guys think?
Well, I would say yes. It's become a tidal wave of confusion that is currently sweeping through the West, and this is why I'm kind of say there are some genuine cases of dysphoria, but it seems to be a fad that has just gotten out of control over there, and it's pushed in such a way that it's confused too many people,
especially minors with teachers.
Yeah, I mean, I can tell you, I know of schools nowadays in which the prevalence of trans is shot up. So out of a class of 30, for example, you may have 3, and I just can't fathom that represents the genetic makeup of people as a whole. I think there's a lot of coaching, a lot of fashion, faddism, whatever you want to call it. I think there's a tidal wave of misinformation pushing this cultural agenda.
I agree. I agree completely. You know what I want to just say to that, which is very frustrating, that each side, the left, the right, they're accusing each other. This is what we have in common, is we're accusing each other of the same thing. They're accusing us of being hateful, bigoted, intolerant, and we're saying the same thing about them. So as you know, Dale, in philosophy, the law of non-contradiction states that both can't be right. Someone has to be wrong. So we have to discuss this. But they want to cancel everybody that even has any questions. They want to squash debate, and that's authoritarian. That's so that verges on what Dale and I sort of got into with cults, right? You have abusive churches, which are cults, and there's elements of that where the Catholics came, they shoved the religion down the native Indians here. That was wrong, and they're doing the same thing. So I told the partner of my stepson that, because he told me, well, it's legal. You have to accept it. This is who we are. And I said, wait a minute. It's also legal to be a Christian, and this is who I am as a Christian. So if I go around saying it's legal to be a Christian, this is who I am to be a Christian, implying I'm shoving my religion down your throat. There's all kinds of things that are legally, but they're ethically not legal. Because as many have said, Martin Luther King, I think, said it, Jr., and C.S. Lewis, that you can't legislate morality. So abortion's legal. I mean, drugs are legal now. I mean, but we don't agree with that. Euthanasia is legal. So just because something is legal in a corrupt society doesn't mean it's ethical or it's right. And this is what they don't get. They're very authoritarian, fascist, and so we need to be careful that, we're both accusing each other of the same thing. But I just wanted to bring up a book related to what Melvin was saying. Author Abigail Shriver wrote a book called Irresistible Damage, The Transgender Craze Seducing Our Daughters. And she shows like how in the past 10 years, it used to be boys or males, and now it's teenage girls. It's a new fad that's replacing bulimia and anorexia. So it's like a fad now that these girls are going through. Oh, look at me, I'm special, I'm cool, and that's sick. That's sick that society would be pushing that. We look at the monsters behind the LGBT movement, quack doctors pushing all kinds of crazy things and abusing minors and kids, and now they're doing the same thing. They're sort of following in the steps of their forefathers and not breaking away from that. Nobody's denying that people don't have gender dysphoria. Nobody's denying that people don't have same-sex attraction. We're denying that it is wrong to indoctrinate minors whose brains are not even developed until the age of 30, experts tell us, or 25, between 25 and 30. So let them wait till then. And it's almost like the kids are the doctors. They're diagnosing themselves, and the doctors are scared. So this is the thing, is that more and more experts, psychiatrists, clinicians are coming out now because they've had enough. But their livelihoods are at stake. Their licenses can be removed because they don't side with the radical leftist agenda. So, so this is a scary thing. But more and more speaking up, especially when they come closer to the age of retirement. And again, this is not the far right speaking out. This is their own people speaking out. The LGBT plus community is self-destructing itself.
Yeah, I think you raised a great point about the freedom of speech issue. That's one of the main issues I have on the political.
But that's the pronouns too, Dale. The pronouns. We didn't talk about that. Trying to mandate made-up pronouns.
Okay, yeah, we obviously Jordan Peterson's getting into that. So, yeah. The other thing I wanted to say very quickly before we get into the pronouns thing. The issue of kids. I think it's got to be, look, you've got to be an adult to make these decisions. If you want to be an adult from a legal, I don't support you morally getting surgeries and stuff like that. But once you become an adult, I support you legally doing whatever you want. But with children doing it, irreversible damage to this is just ridiculous. And it's no, I will stand against you. No, we're not doing that to kids. I mean, when I was a kid, I imagined myself Batman, but my parents didn't say, okay, get out there and start fighting crime. And we're going to support, take you to where the bad guys are. And you're going to like jump off buildings.
Dale, I'm glad you brought that up. Because when I was a kid, I'm a little bit older than you, so you might not remember this.
You knew me as a kid. So
yeah, I'm 54. So when I was a kid, the big thing was the Superman movie with Christopher Reeve.
Mm-hmm.
So, there's three parts to it. But anyway, kids were dressing up like Superman and jumping off balconies. So kids are impressionable. Kids' minds are not rational. They live in the realm of fantasy. And for teachers and activists to come in and to insinuate that because they may be a little more feminine or masculine, on either gender, that this is who they are, is abuse at the highest level. It's a crime. It's a crime.
Mm-hmm.
And people are waking up to that reality. Now there's lawsuits, so it looks really good on them. There's all kinds of lawsuits from people who have sex change regret. So I just wanted to bring something up on the theological level and get Marvin's perspective. I heard a theologian say that the term self-identification, and I think I told you this, Dale, before. Self-identification is a divine attribute because God is the only one who can self-identify because he's self-created. And to self-identify, you have to be all powerful and have all knowledge. So only God can self-identify, and he does when he says, I am that I am. And then Jesus obviously over 14 times said, I am that I am. So if you're a boy, you don't have the right to say I am a girl because you're not God. You're playing God. Only God can say I am this, I am that. So back to sex assigned at birth. That's a real stupid term because sex is not assigned at birth. It's recognized at birth, not assigned. It's recognized. You're either male or female based on XX or XY. They say that every gene, every tissue in your body is male. So they find a transgender female, which would be a biological male. If they find their bones, like even the size of a penny, in 100 years, they could tell just from that bone, and that's a male. So you can't fool science. Every bone, every tissue, every hair in your body is determines your sex.
Yeah, Marvin, did you want to comment on what you?
No, I'll just say that problem is exacerbated if you're a physicalist, right? And you believe there's no soul or spirit.
Right.
You just are your body.
All right. So we have one last question from the audience that I think is relevant, and it comes from a pro-transgender side or pro-LGBT side. But Udahef, he was responding because in the comments I said, look, all three of us, in terms of Matt, we love you. We want you to repent and come to a knowledge of the truth. And sometimes love has to be tough love. We have to tell you the truth, the biblical truth. Otherwise, we're being unloving. But Udahaf says, be careful, Matt. They quote unquote love you, but when Christians say the word "we love you," we're using the word different from other people, and I think, guess what? That's absolutely right. When Christians use the word love, we're not just talking about some mushy, I have feelings towards you and I have these sentiments. That might include that, but really for the Christian, we're commanded to have agape love.
Mm-hmm.
And that is different than the
Yeah,
world.
that's a good point there, because I see a big sign during Gay Pride every year that says love is love. Well, love is not love. You can't define a word by the word. The Bible says God is love and God is righteousness. So according to the Bible, if you look at 1 Corinthians 13, love is not a feeling; it's a virtue. Love is not acceptance, but it's truth. Love is not pride. That's interesting. It doesn't celebrate iniquity. It doesn't seek its own rights. So everything that they believe, seeking your own rights, celebrating iniquity, and pride, is the opposite of love. It's hate. So we have different definitions for love. Love is not acceptance. Love, by definition, is exclusive, just like truth is, and it's intolerant of lies. And it's a lie that you can say you're different. And Matt brought up a good point, because they say on one hand it's a social construct, sex, but then they use stereotypes within the sexes to identify as transgender or gay. So it's a complete contradiction, where they live in the physical world, but they don't want to accept the physical world, because the physical world says you're a biological man. That determines it. So I don't buy the nonsense that sex and gender are different, or you know what I mean, you're born in the wrong body. I think you're just confused in your brain, and there's therapy for that. I mean, it's schizophrenia. It's a form of schizophrenia. It's delusional, believing something you're not physically. So it's interesting, though. I'll just say this, and I'll shut up. That they say that they want to align their bodies with their mind, but in reality, all the experts now who are leaving the LGBT movement are saying, well, now you have another problem, is that they're not aligned. Their minds are not. So their bodies now, or the way they're presenting, is not aligned with reality. You know what I mean?
Right.
So they've created a bigger problem.
Yeah,
And in agreement with my brothers here, there are three notions of love mentioned in the in the New Testament. There's philia, which is brotherly love.
Yeah.
There's eros,
Yeah.
which is erotic love. There's storge as well, another type of love.
Right.
And there's agape, which is self-sacrificial, the giving. And when we say we love Matt, this person who Matt is talking about, we're referring to agape, which means giving whatever we can of ourselves to make sure that we give Matt, or whoever Matt is defending, the exact correct advice to allow them to come into a relationship with Christ, even though it costs us, and it does cost us. It costs us unpopularity at the moment, doesn't it? It costs us the counter-cultural sort of lives that we lead. But this is the kind of love, the highest love, that we're trying to demonstrate to Matt. So, when we say we love you, we're talking about a love that is of a much higher order than eros, for example.
Absolutely. Awesome. All right, cool. Well, that does it for the relevant audience questions. Obviously, there's a lot of other stuff in there that I could see, but the last thing, Jaime, you said you wanted to say something about pronouns. So I'll give this as the last topic for today.
Not really. It's just, it gets ridiculous where people refer to them as they, or they make up their own pronouns. Yes, they make up their own pronouns for he or she or us. I mean, it's just you're butchering the English language. It's like our perceptions and feelings don't determine reality.
I was listening to an American actor, African American, James Chappelle.
Oh yeah,
Dave Chappelle.
And he said he went he always wanted to meet Jim Carrey.
Hmm.
And he said he went to meet Jim Carrey, and Jim Carrey was in a character, and he wouldn't break character.
Hmm.
And even though he was looking at Jim Carrey wasn't Jim Carrey. He was the actor. Excuse me,
Right.
he was the character that he was portraying at that moment.
Hmm.
And Chappelle said that's exactly how he feels when he's talking to trans people a lot of the time. Just thought was quite
He's-
funny.
So is he saying, I guess they're actors?
Well, basically, he's saying, you know, you want me to take you as a woman, and you've got a protruding Adam's apple and 9 o'clock shadow. It's quite difficult.
I do actually on this pronouns thing. I do actually have a serious question for both of you, and this again that will close out the show here. But so I on Faith Unaltered, they did a show on transgenderism, and on that show they had someone that I consider a friend, an atheist named Jordan from Reason to Doubt.
Yeah, I
And
saw it. Yeah.
you saw that, right? And yeah,
I saw the other day with Jordan. Yeah.
oh, on the God debate, yeah, he was on my show debating the existence of God, but on the transgender show, he raised this issue. Like, look, for the sake of argument, let's pretend these pronouns, you guys are all right. It's all ridiculous. It's not reflecting reality and stuff like that. But he raised this issue. But some people who are trans, there are legitimately trans. They have this dysphoria and stuff like that. So they're suicidal, right? They end up killing themselves because people aren't respecting their beliefs, whether right or wrong. And the thought experiment he gave is like, well, look, don't most Christians say that it is okay to lie to save a life? Like it's the lesser of two evils. So if a transgender said like, look, maybe you don't believe it, maybe it's not true, but just call me whatever I want you to. Otherwise, I'm going to kill myself. Should a Christian lie in order to save a life, or do you guys think that's too much of a trade-off?
Well, my view on it is that's kind of a blackmailed, compelled speech. I leave it up to the individual. I would just find it difficult to call somebody their pronoun because they decided that I should subscribe to their version of reality. So, I know my kids tell me, you know, they were being polite to a trans person whom they know, and called him her because they thought they wanted to be referred to as a her. And then this person bit their head off and said, "I'm not a her, I'm a them." You know, and I just think it's just a merry-go-round. So I would say to Jordan, no.
Cool. Jaime, what's your take?
Sorry, not Jamie, to Jordan. I would say no. Yeah.
I think each situation depends on the circumstances, but I really don't know the answer to that. I'll stay neutral. But I do agree with what Marvin says. It could be seen as blackmail. When someone says to you, it's legal, this is who we are. Well, that's not who I believe you are. That's not you see yourself as a female. I don't see yourself as that. It doesn't make me a bigot. It just makes me someone who has a diverse opinion, a diverse view based on mine's based on physical reality. Theirs is based on personal reality.
But I think that what I would say though to somebody like, let's say Jordan wanted to be called a her, I would just call him Jordan.
Mm-hmm.
Yeah,
just
I wouldn't be compelled to speak.
Yeah, but then it gets more complicated when there are family members. Say it's a wife or husband or child. That's different, I think, from a stranger.
Yes, good point.
So this is the issue, and I guess you're enabling a delusion. You know what I mean? So
very good point. Very good point.
There are costs beyond just.
That's why I say I don't know. There's two sides to it. The situation. I don't know.
Yeah, that raises the stakes a 1,000-fold, a million-fold.
Yeah, like my two kids see my stepson as a male and his male name. They don't acknowledge, and that's created tension, right? So
Yeah.
They're saying we're not being respectful to him, but then he's not being respectful to us because we don't see him the way he sees himself,
Mm-hmm.
right? So your definition of female is not my definition of female,
Mm-hmm.
right? Because they went from it being a third gender, transgender, to now they got rid of that. So now many of them are saying they're not even transgender. It's not a transgender woman or transgender men. They're actually a woman. They're actually saying they're a biological woman, even though
Okay.
they're
Okay.
born a biological man. So it's progressed even to more insanity. It seems like insanity doesn't it becomes worse.
Mm-hmm.
Yeah. Awesome. Yeah. Thank you guys for answering that. I know that was a tough moral dilemma, right? Because that's a case where we have this conflicting.
I'll give you another one that I'm stuck on to get your perspective on. Would you go to a gay marriage or a trans marriage, especially with a family member? So say Dale was
That's a good one.
hypothetically it was your brother or your dad or your mom, not just a friend. So
Oh,
that's a tough one.
Oh, so my answer is I would not go to that. I wouldn't participate in any way that served the purpose of endorsing that. So I think my going to the wedding would kind of be a statement of endorsement.
Right.
But I would still be good with my brother. He's still my brother. I still love
Good to
him.
keep the communication open. Yeah.
Yeah, of course I would keep the communication open. My brother's an unbeliever right now. So I mean, it's not like sin is sin, whether it's heterosexual or homosexual. So I love my brother, regardless of what sins he creates. And just as I do for the people in the audience, I'm praying that he'll repent and come to full faith in Christ someday. So yeah,
I think I would go.
okay.
And I think I would go,
Mhm.
but I think as the opportunity arose, I think I would definitely make sure they knew my views on the issue, and
Okay.
I would make it clear that I can't really rejoice with them or celebrate with them
Right.
because what is happening is not a good thing.
Yeah.
But I do sort of think enough of them as individuals to sort of just want to support them and support them if I can.
Yeah, I agree. I don't think we can be absolute on that issue. I think we can agree to disagree.
Yeah.
I'm sort of stuck in the middle, but this gets to a bigger issue which we didn't address. I'm not sure this time now, but the whole concept of the Christian cake maker or the Christian web designer who refused to provide services for gay and trans people. That's another huge issue, and they won their cases, by the way. The web designer and the cake maker, and there's others, jewelers, wedding people that provide, wedding attire. So it goes on and on and on. They're refusing to provide services.
All right.
Which is
I think they should be free to not provide services that are that contradict held beliefs.
Right? You have to provide an accommodation where you can go across the street.
Yeah, you're not going to get gay bakers baking, we live in Sodom cakes.
Yeah, and the thing they don't tell you about that, because it was on CNN and I read up on it. See, this is the other thing is that, like, the LGBT community, in my perspective, is a social cult, just like there's religious cults. It meets all the qualifications of a cult: authoritarianism, intimidation, manipulation, blackmail. Meets all the qualifications.
And just for the audience, Jaime, I'll let you continue. But you do have expertise in cults. Like we did the last show we did was on cults.
And you had your friend who was an atheist. Your friend who was an atheist who agreed that there's social cults and there's religious cults. They believe different things, but their mechanisms, their behaviors, their attitudes are the same. So,
totally agree.
Yeah. So, with the thing with the cake maker, they cherry pick. Cults cherry pick their doctrine. They're selective. They make a pretext out of the context. So in that case, he did not refuse them service. He refused to do a custom cake that says "Congratulations, Steve and Bob," and to show up at the wedding with the cake and present it to them and congratulate them personally. He actually said, "You can buy one of the cakes in the refrigerator, or I can even make a cake for you. But you have to put congratulations, Bob and Steve, and I'm not going to deliver it to your venue. So it's not like he denied them complete service and then he provided an accommodation, but my colleague across the street, he'll do it.
Yeah.
Awesome. All right. Last thing I'll just bring up. This is for me, so I'll answer this quickly before we close out. But Brian, yeah, I think the same thing. My answer would be the same. I wouldn't attend the wedding as a statement of endorsement for a divorced person who's getting remarried or something like that. Yeah, so I would be consistent on that front. And yeah, all right, cool. So with that said, I want to say thank you very much to my guests and stuff like that for giving your opinion. Very informed, very educational and helpful. And I know we've had a mix in the audience. We've had people who agreed and people who disagreed with us. But at the end of the day, it's God's truth that matters. So I'm grateful to you guys for standing up and giving the truth, the biblical truth. So yeah, I hope you guys
Thanks for having me on the show.
Thanks, guys. Nice meeting you, Marvin.
Good to meet you, Jamie. Thank you. Bye.
All right. Not just for the audience. So at 1:00 today, I'm doing another podcast with Dr. David Kemble Cook and the atheist David Johnson. And that's going to be on the topic of miracles and looking at David Hume's a famous argument against miracles, saying, basically it's more probable that people would lie or be deceived rather than that an actual miracle would take place. So I'm going to be kind of responding to David Kemble Cook's objections on that front. So yeah, have a great day.
Hume is interesting because he's got to be the most unreasonable philosopher to have ever lived.
Wow.
Some of the stuff he says is just potty skepticism.
It amazes me how skeptics, even David Kemble Cook was saying how he was a former Christian who's deconverted, just so everyone knows. And it just amazes me. They still use David Hume's arguments, even though they've been refuted time and time again over the centuries. So yeah, I'm just amazed people think
I digress.
Fair enough. All right, guys.
All right.
Have a great one and see you guys in a couple hours. I'm hitting the red button.
Yeah, take care. Bye.